Welcome to the MS&Me Radio Network. The broadcast shows are for informational and entertainment purposes only. They are not designed to provide listeners with specific personal, medical, or counseling advice. Individuals with a medical issue should always consult their healthcare provider. MS&Me is not responsible for content of individual shows. The views expressed by show hosts or their guests are their own. Enjoy the show. Welcome to MS&Me Interviews, countdown of our top 5 MS news stories we've discussed here in 2017. I am your host, Erica Lyons Richardson. 2017 has certainly been a notable year for MS research and treatment of patients living with MS around the globe. I've had the honor of interviewing MS clinicians and research scientists from around the world this year. It was difficult to choose just 5 for our list tonight. Here's our list of the top 5 interview topics that also made headlines in 2017. Drum roll. Number 5 on our list is the blood test for MS. It was just this February we reported scientists in Australia had discovered the first blood biomarker for multiple sclerosis, a chemical identifier in the blood. We theorized that the discovery should lead to a simple blood test that makes it quicker and easier to follow the course of multiple sclerosis. The researchers in Australia led the 12-year international effort that identified the biomarker. It will allow the clinicians to determine which of the 3 types of MS a patient has with about 85 to 90% accuracy. By May, the US-based IQity had released Isolate MS. It's the first RNA blood test for MS. It gives your provider information at the earliest sign and symptoms that it's greater than 90% accuracy with that RNA blood test. Now, I had the honor of interviewing IQity CEO Dr. Chase Spurlock, who shared with us that his research began on this at Vanderbilt University Medical Center more than 10 years ago. It was with funding from the National Institutes of Health. Dr. Spurlock explained that while DNA is a term that we're probably most familiar with, it's only able to tell you if you're at risk of developing a certain disease. But RNA expression looks at what's going on with your body in real time, if a disease is present or not in your body. The Isolate MS test is only available here in the U.S. at this time, unfortunately. You must already be exhibiting MS symptoms, and it's by doctor's prescription only. It's not covered by insurance. However, there is financial assistance information available on the IQity website, which is iqity.com. New research was touched on at ECTRIMS this year, the European conference. The research focused on neurofilament light chains detectable in our blood and in cerebrospinal fluid. The results of the research can mean the development of a biomarker blood test that could track progressive damage or indicate success in suppressing that damage by our MS treatments. Not many details were given, but it created a lot of buzz at the ECTRIMS conference this year. But last month, more details were released. A blood test to monitor a nerve protein in the blood of people with MS may help predict whether disease activity is flaring up, and that was according to the study published November 29, 2017 online issue of Neurology. So you can look up that publication. These blood tests can provide a low-cost alternative to MRI for monitoring disease activity. A blood test may also be a good alternative for those who fear the small enclosed spaces required when we get our MRI scan. And I know a lot of you suffer from that anxiety and have issues getting into the MRI. So that would be a real blessing for many patients. Researchers monitored the neurofilament light chain levels in the blood of people with the relapsing remitting form of MS, and they found that levels of this nerve protein were higher when people had new disease activity and lower when they took medication to reduce the number of symptom flare-ups. But limitations of the study include that people in the study had more frequent MRI scans than they would have during regular MS care. Also, while most patients experienced new lesions during follow-up, not all had relapses. So future studies may want to consider a longer time frame for follow-up. Number 4 on our list this year is I interviewed my own mother about my childhood living with pediatric MS. I know many people don't even realize that there are pediatric cases of MS. I grew up, I've almost been living with MS for 40 years now. I have primary progressive active MS, which means I have constant steady progression, and I have relapses on top of that, which are kind of fast forwards in my disease progression. There was very little understanding and no approved treatments for children when I was growing up. Not only was I judged, but my own mother was judged for having a child who was fine one minute and lying on the couch or in the bed the next. So she spoke about that in our interview, and it was, she was judged for not being able to explain exactly what was going on with me, and it really was a confusing time, and there were no treatments. Can you imagine your child having a disease or even being tested for a disease where the doctors tell you there are no treatments? Not only is there not a cure, but there are no treatments. So I'm sure that's just, terrifying any parent that hears that. Not only, do you have to deal with that, but you have to deal with the fact that the disease itself, even among adults at that time, wasn't even understood completely. But just a couple months after that interview was taped, the U.S. Food and Drug Administration, the FDA, granted breakthrough therapy designation for fingolimod for the treatment of children and adolescents 10 years of age or older with relapsing multiple sclerosis. Now, what is breakthrough therapy designation? Normally, the approval process here in the U.S. By the FDA for these treatments, for any medication and treatment, it takes a very long time. It's a lengthy process for safety purposes. And breakthrough designation gives you kind of a fast track through this process, so it can usher that treatment to the market. So that's very exciting if you have a child who has MS or is being tested for MS. So fingolimod, also known as Gilenya here in the U.S., is approved to treat relapsing forms of MS in adults. So it's been in use for adults for many years. Gilenya is not currently approved for children and adolescents with relapsing MS. Their breakthrough therapy designation is based on the data from phase 3 paradigm study. It evaluated the safety and efficacy of fingolimod versus interferon beta 1A in children and adolescents age 10 and older with relapsing MS. Paradigms is the first completed randomized controlled clinical trial specifically designed for pediatric relapsing MS. And it found that the treatment with fingolimod resulted in an 82% reduction in the rate of relapses in this patient population over a period of up to 2 years, compared, of course, with the beta interferon. The safety profile of fingolimod in the study was overall consistent with that seen in the previous clinical trials in adults for that same medication. Despite the fact that children experience approximately 2 to 3 times as many relapses as a typical adult onset MS patient, there are currently no disease-modifying therapies approved for the pediatric population. Of the 400,000 known cases here in the U.S. alone of multiple sclerosis, around 10,000 are under the age of 18. You can only imagine how that increases globally with the better reporting now of cases of MS. My own sons are currently undergoing testing and monitoring, and I can tell you when I heard that this breakthrough status was granted, I was ecstatic. Okay, number 3 on our list this year is the discovery of the lymphatic vessels in the brain. This was groundbreaking. In 1816, an Italian anatomist reported finding lymphatic vessels on the surface of the brain while dissecting cadavers. But for 2 centuries, this information was forgotten. Until very recently, researchers in our modern era found no evidence of a lymphatic system in the brain, leaving some puzzled about how the brain drains its waste. And others concluded that the brain is an exceptional organ that just didn't have a lymphatic system. And lymphatic vessels carry waste for the rest of the body. This year, I was honored to interview Dr. Daniel Reich, a physician scientist with the National Institutes of Health. He's a neurologist and a neuroradiologist director of the Translational Neuroradiology Unit in NINDS. That's the National Institute of Neurological Disorders and Stroke. In his clinical practice, he cares for patients with multiple sclerosis and other neurological diseases. And he also leads several clinical studies focusing on multiple sclerosis. The research in his lab focuses on the use of advanced MRI techniques to understand the sources of disability in MS and on ways of adapting those approaches for research trials and for patient care. Dr. Reich's team used advanced imaging techniques to identify the drainage tubes. The team discovered lymphatic vessels in the dura. That's our leathery outer coating of the brain. And they may serve to remove waste from the brain. These vessels are known to run alongside vessels and provide a route for the recirculation of plasma and white blood cells through the body. Dr. Reich's team's findings indicate that lymphatic vessels may serve as a link between the brain and the immune system. This may have relevance to diseases including multiple sclerosis, it ushering in a whole new area of research. It really was an amazing discovery, and I had a really informative talk with him. He's had so many great research studies, and it was just a pleasure speaking with Dr. Reich. Now, number 2 on our list is ECTRIMS, the largest global MS event of the year. The 7th Joint ECTRIMS Conference was held this year in Paris, France. It was 4 days of exciting clinical and research advancements. With more than 10,000 delegates, this was the largest conference in multiple sclerosis so far. It was amazing. For those new to the MS community, for a quarter of a century, ECTRIMS has served as Europe and the world's largest professional organization dedicated to the understanding and treatment of multiple sclerosis. The European Committee for Treatment and Research in Multiple Sclerosis, or ECTRIMS, is a nonprofit organization and an independent representative European-wide organization devoted to MS. ECTRIMS works with researchers and clinicians of its member countries and with other organizations that share similar missions and objectives on a worldwide scale, creating a networking and collaboration opportunities. The ultimate goal of ECTRIMS is to improve basic and clinical research and clinical outcomes in patients living with multiple sclerosis. This year's program was full, starting on Wednesday, October 25th, with a day including 18 teaching courses on topics across the whole of the MS spectrums, as well as 2 nurses sessions, emphasizing the importance of MS specialty nursing, both for clinical outcomes and for research advancements. The main conference started the following day with a lecture by Dr. Hans Lassmann from the University of Vienna. It succinctly explained the advances made in clarifying the pathophysiology of this inflammatory disorder, the insights into the phenotype of brain infiltration by T and B lymphocytes, and the clinical implications of the findings for further questions of research. Over the next 3 days, attendees heard about clinical and scientific advances in adult and pediatric MS, as well as other demyelinating conditions such as neuromyelitis optica, spectrum disorders, or NMO. You may have heard of that as NMO. Overall, the 7th ACTRIMS meeting this year highlighted the extraordinary advances in this field of neurology, both in terms of mechanistic insights and therapeutics, in other words, MS treatments. Most importantly, it brought together clinicians from across the globe in a beautiful venue, promoting further discussions and collaborations. The 8th ECTRIMS meeting will be held in Berlin, Germany on the 10th to 12th of October 2018 with hopefully even more exciting discoveries. It really was amazing this year. Now, drum roll please. Number 1 on our list this year was called a game changer. Ocrelizumab is a humanized monoclonal antibody designed to selectively target CD20 positive B cells. It's a specific type of immune cell thought to be a key contributor to myelin and nerve cell damage. So Ocrevus is approved as a treatment for both relapsing MS, so relapsing remitting, and for primary progressive, or PPMS, those forms of multiple sclerosis. It has, although, been prescribed for use in all active types of MS. Approved first in the U.S., then in countries around the world in 2017, Ocrevus made headlines as the first treatment approved for primary progressive MS. It really was a game changer for those of us who have PPMS. I had the pleasure of interviewing Dr. Aaron Boster of the Ohio Health MS Center. He was involved in the trials for Ocrevus, and his center administered the first doses, the first infusions here in the United States. Often referred to by the patients as chemo light, the first treatment is administered by 2 IV infusions, 14 days apart. Then subsequent doses are a single infusion every 6 months. But there's a big difference between monoclonal antibodies against cancer and traditional chemotherapies. Traditional chemotherapies work by killing any multiplying cell. Cancer cells multiply, but so do other cells, which is why such therapies can give nasty side effects, such as severe nausea and hair loss when you're treating cancers. Monoclonal antibodies in cancer therapy represented a breakthrough because they targeted particular cells, thereby limiting risk and side effects. They have now been applied to conditions like multiple sclerosis. With its competitor Rebif costing $86,000 a year, we all braced ourselves for the price of such a highly anticipated treatment. And it was only $65,000 a year, so that was seen as groundbreaking when they released the price of Ocrevus. I mean, when I heard $65,000 a year for Ocrevus, I was like shocked. I really was. So how effective is Ocrevus in the treatment of RRMS? In 2 clinical trials sponsored by the drug's manufacturer, RRMS patients were given Ocrelizumab, Ocrevus, they had about 50% fewer relapses and up to 95% fewer new lesions on the brain and spinal cord than those who were given Rebif, a common therapy. So that's what it was compared against. For patients with PPMS, they were 24% less likely to have disease progression than those taking Rebif. So NEDA, which is no evidence of disease activity, is a common parameter that measures the absence of disease activity. So in clinical settings and in MRI imaging, in MS patients, they use this parameter. This parameter is increasingly recognized for its utility in clinical trials and in its potential goal. So its ultimate goal of MS treatments is to reach no evidence of disease activity, so NEDA. So, I mean, technically it wouldn't be a cure per se, but no evidence of disease activity, which is the closest thing. So, researchers reanalyzed the results of the OPERA studies to assess the effects of Ocrevus on NEDA. So they wanted to measure it, against that goal of no evidence of disease activity. The team found that a higher proportion of patients treated with Ocrevus achieved NEDA during weeks 0 to 24 when compared to patients receiving Rebif in the same period. The positive effects of Ocrevus continued after week 24, with patients exhibiting NEDA during weeks 24 to 96. This, researchers found, represented a 72% increase in NEDA relative to patients treated with Rebif. So 72% more of patients treated with Ocrevus reached that goal of NEDA, no evidence of disease activity, in comparison to the Rebif patients. Now, patients who still exhibited early evidence of disease activity in week 0 to 24 or weeks 0 to 48 were treated with the Ocrevus, eventually also reached the NEDA in weeks 24 to 96 or 48 to 96 respectively. So NEDA was always detected in higher proportion in those patients who were treated with Ocrevus, relative to the Rebif patients. So specifically, 177% and 81% increase in NEDA relative to the Rebif at weeks 24 to 96 and 48 to 96 respectively was achieved. Can you imagine that? 177%. So that's why everyone was going, it's a game changer. So there was new information presented at this year's ECTRIMS that Ocrevus improved visual function as well. So Ocrevus, or ocrelizumab, was associated with a significant improvement in visual outcomes at 12 weeks in RRMS patients compared to interferons. So that was exciting news as well. Those of us living with PPMS hope that this is just the first step into increased research for PPMS. There are other treatments coming down the pike for PPMS, but I know as someone living with primary progressive MS, Ocrevus was seen as our hope, our one light of hope, that we were holding on to, our very first treatment approved for us. And we were hoping that that was just, the tip of the iceberg, and that more treatments, of course, will be coming down the pike. Because when you think of it, if you're living with RRMS, you're dealing with all these choices, tens of choices for treatments. Like if one doesn't work, you react to one, or your body gets used to one, and then you start having relapses, you start showing new lesions, then your doctor's going to switch you to a new treatment. You have another choice. If you have a horrible reaction to a treatment or something they switch you to, you of course have another choice to try. Your doctor will go to a more appropriate therapy. If you have PPMS and your body doesn't react like you hope it will to Ocrevus, or you have horrible reactions, there's nothing else yet to switch you to. But that is going to change. We will have choices. So hold on to that hope. There is new research. They're also including more of us with progressive MS in trials, SPMS and PPMS. Also, in our progressive forms, we are more likely not to be ambulatory. In most of these trials, they're doing the timed walk as the measure of it, are these treatments working? Well, not of all of us are ambulatory, so that we can't walk. That wouldn't apply to us. So we want that shift, in them actually measuring as progressive patients on upper body function as well. Has our arm function increased? Because many of us are in wheelchairs, and we like to be included in those trials of research as well. So that will be a big change as well coming for those of us living with progressive multiple sclerosis. So I want to thank you all for joining me for our 2017 countdown. We hope there are even bigger stories and research strides to report in 2018. And we will be following those conferences this year, the ACTRIMS conference here in San Diego this year, and also the ECTRIMS conference over in Germany for 2018. So we will report all of those on our website. Our website is www.msandmemedia.com. That's msandmemedia.com. We will report them on our patient forums, our Twitter, our Instagram, and of course, our host on our 24-hour radio network will be talking about those important topics as well for 2018. So stay tuned to MS&Me, and we hope that you will follow up with MS News and patient stories on our website this year. So Happy New Year to all, and I hope you listen to my show MS&Me Interviews again next week, right here on MS&Me Radio Network. Thank you all, and I wish you joy and happiness in 2018.